Dear friends, it's really a great pleasure and honor indeed for me as the organizing chairman of WCC PCI 2015 to have the first day, 3rd of September, our beginning of the conference. I must say today that this is the 10th anniversary of WCC PCI. The seed of WCC PCI was nurtured, sown here 10 years ago. Same place, and today we are having a 10th conference. On this occasion, we are having a very special project, and the name of the project is again WCC PCI and Emergency Services Foundation Stone Laying Ceremony. This is going to happen on the 10th anniversary. Ladies and gentlemen, I am really very happy. The person who is working with me all the time, everywhere, whatever I say, is not from the East Coast, he is from the western part of the world, who is none other than our own Dr. Navin C Nanda, the international president of WCC PCI. We are working together for the last 10 years when bringing the awareness in the people on prevention of the heart problem in India. We really believe healthy heart is the only way of having a healthy environment, and healthy environment is the only way of creating a healthy India and the world around us. Here with us is Navin C Nanda. You all know the theme of World Heart Foundation this year is healthy heart and healthy environment. Environment is healthy, our heart is healthy. If our heart is healthy, environment is healthy. When we talk of environment, it can be internal environment, what we call the microcosm, and external environment, what we call the macrocosm. Let's talk to Navin, who has come all the way from the University of Alabama, a distinguished professor of medicine and cardiology, pioneer of echocardiography. I called him not only a legend of an icon of echocardiography, but a world father of echocardiography. Navin, what's your opinion about the WCC PCI and your involvement? What it was, what it is, and what is going to be the future of WCC PCI? Navin.
Well, first of all, it's a great honor for me to be part of this Congress and also part of this project. And as you know, Dr. H.K. Chopra is the one who actually began this conference, had this vision of having this World Congress of Preventive and Clinical Cardiology and Imaging 10 years ago, and actually has nurtured it so that now it's one of the major conferences, not only in India, but actually also in the world. It's one of the very major conferences that we have on prevention and clinical cardiology. So it's all due to his vigor, due to his hard work, and due to his superb organizational capabilities that this conference has reached the level, high international level that it is at present. The other thing, of course, is with this conference is going on for 10 years, it's natural that this will culminate in a sort of something more concrete, not just a conference, but something more concrete, which will actually benefit India, also which will benefit the common man, and that is this development or the launching of this very large center, sort of a world center, which again would be of very international stature, world center, which will go focus on prevention, on treatment, and of cardiovascular diseases, and maybe hopefully in the future could go on to some other specialties also. But to start off, it will be from this, and it's really, I'm really very pleased and delighted to see that the Brahma Kumaris, from Dr. Chopra's urging, has agreed to actually donate land for this, and also have actually taken a very key active interest in making sure and laying the foundation stone and making sure that this will come to fruition in a very short time. So that is something very, very, in Western world, if you have something like this, it will take years and years to develop, but here actually with the Dr. Chopra's energy and Brahma Kumari's vision and strength, I think we are going to see this develop to a very major world center in a very, very short time. So I'm really delighted and pleased and honored to be part of these projects.
Navin, I think you gave a brilliant exposition in a short span of time, and you mentioned about the World Center of Clinical Preventive Cardiology, Imaging and Emergency Services. You're an amazing guy. You got a lot of work in imaging. You're an echo guy, famous all over the world, and pioneer in the research of echocardiography. 7 acres of land being allocated today. My Nirvair Bhai, Satish Gupta was there, and Dr. Midda was there, and they mentioned that it's going to be just a beginning to give you 7 acres of land, and it can be expandable to any level, any extent which you want, because they have 65 acres of land. You being an imaging guy, what's your future of imaging in a center like this? Because I personally believe that imaging has a huge scope in early diagnosis, early screening and prediction of coronary artery disease, which may really help us in salvaging the damage to the jeopardized myocardium, which is under stress most of the times in young individuals in India. What's your opinion? Is it really going to help? And what modality of imaging you think should need to be focused on, Navin?
I think you have really hit the nail on the head here. That's really the focus, because imaging, especially if it is non-invasive, is first of all, it does not produce any discomfort to the patient, is not at all, there is no side effects to this. For example, ultrasound has been used to look at fetuses, for the last 70, 80 years, and there has been no side effects at all. And it's also very cost effective. If you think in terms of other developments like invasive, there's a lot of cost outlay, while this has no cost outlay. And because of that, this is something which will be very, very useful in a country like India, which, where the budget considerations are important. They are all important everywhere, but even more important so because of such a large population, that this is really would be a very big boon having imaging here. Not only that, and this of course will be supplemented by interventional procedures, and it has to be something which is completely as good as anywhere in the world, maybe even better, because of the resources you have here, and because of Dr. Chopra's inspiration, hard work, and the resources that can be there because of the Brahma Kumaris, and knowing how well the organization is. This should really be a very prime center in the whole world, actually.
I'm very happy, ladies and gentlemen, that Navin has just spoken that it is the Brahma Kumaris organization of the world headquarters who has taken the lead of mingling science and spirituality to give a healthy heart. And they also believe not only in spirituality but also in the technology to enhance the healthy heart care to the best way possible. And I am very happy today that after 10 years of the inception of WCC-PCI, we are launching the first phase of WCC-PCI emergency services today. And we have the father of echocardiography with us, who believes that screening of a human being by an echocardiography is the most powerful predictor of a premature coronary artery disease, because we can screen the carotid vessels, we can see the anchor brachial index, and we can also measure very briefly even the iliac artery intimal media thickness to predict the premature coronary artery disease, and it can be done in a very, very big way. To start with, Navin has mentioned very clearly that it is not going to be only a diagnostic modality but also a prognostic modality, and he emphasized, Navin, that we are also going to use the imaging technology in the intervention. Intervention is a very important tool here. As I mentioned, the center's name is not only preventive for an imaging but also emergency services. Without imaging, we cannot provide emergency services. Ladies and gentlemen, this is going to be one of the best centers in the world. I know in the next 2 or 3 years, the whole world will come here and try to do a research not only in the interventional cardiology but also in genomics, in genetic analysis. So Navin, being a pioneer, and he has a different vision for every new project we think. I'll ask a last question to Navin. Navin, what do you think are going to be the innovations in cardiology through this center, which will create a huge impact in the world? Navin.
I think the major innovation is actually the combining of or introduction of spirituality in treating and managing problems which involve the body of man, and I think that'll be something very important, very unique, because we all know that many of the illnesses have a very strong mental component to them, and that is where actually spirituality can be very, very extremely helpful. So this will be something very unique, and I think as something which will maybe other centers in the world would also try to follow.
Navin, I think, do you think that we are going to help really the emergency care to the center in the form of providing emergency ambulance services, especially for heart attack, or airlifting a patient from one place to another, or in a trauma center? Because our aim is that people who are victimized in a road traffic accidents, or people who have a massive heart attack and they are not having the accessibility to an immediate angioplasty, primary angioplasty, they can be given a clot dissolving drug or a clot buster, can be given right instantaneously under the supervision of imaging. It will really help in saving the human life. Do you think it has a value addition if this center comes?
Yeah, I think it's absolutely. I think it's very, very important because there's a big need actually. There's a need of the hour actually right now in India. You have someone who is a victim of an accident or some other type of trauma, and there is just no way for that person to know, or even the lay people or even there to know where to send him, where to triage this patient, where actually to send this patient, which hospital to go to, and what emergency service can provide it on right there at the spot. And now I think with the new technologies coming in imaging and all, you can actually read the EKG many kilometers away and tell the person, the paramedical who is taking care of it, what to do or what injection to give. And that can be absolutely life-saving, because many of the people who die, they die, 50% of deaths occur before the person actually goes to the hospital. So that's very, very important component. And I think knowing that it will create some research, but at the same time there'll be training of these paramedical people, training so that you can save the lives of the patients. So this is actually a very, very important component of this institute, and that's the emergency portion of the institute.
So Navin, I think it's very important that you brought a new vista, that we are going to launch some smart heart app on this occasion of launching this important center. And the smart heart app will give the information about the symptomatology of the heart attack, which is usually missed, ill understood, underdiagnosed or misdiagnosed, and that's what the delay takes place. So we increase the awareness on the symptoms of heart attack and take the awareness on an early and instantaneous treatment to prevent the damage to the heart and take the patient right in time for an emergency intervention in the form of clot dissolving drug and save the myocardium to a large extent. And this may really help us in reducing the rising menace of coronary artery disease in India. Navin, I think it's a very brilliant idea. You mentioned that we have to launch many apps now in the years to come, and during inauguration we are going to launch 5 apps on prevention of coronary artery disease, and in the years to come from this center we'll launch many apps mingling science and spirituality for a healthy heart. Navin, I really enjoyed talking to you, and I think you give us a lot of inputs, and I'm sure every year with your help as a delegation from API and a delegation from American College of Cardiologists of Indian origin from United States and many other organizations from United States, you will try to make this center a unique center and a center of talent and research in the years to come in the form of translational research. So this is going to create a huge impact in the world. Thank you very much, Navin.